What if I tell you that behind the scenes, Selena Gomez battles a severe disease, an illness that is so severe that it nearly took her life? Yes, Selena Gomez looks fine on the inside, performing on stage, smiling on red carpets, but inside, for many years, she's struggling, suffering from a disease that eventually attacked her body. What is that hidden disease that was causing her body to shut down? And what extreme life-saving surgery did she eventually need to survive? At first, the symptoms were subtle, but they were frustrating. In 2013, Selena felt tired, exhausted. She started experiencing low-grade fevers, joint pain, and an unexplained headache. But like many young women, she had to push through it. She was on a tour, making music, and constantly in front of the cameras, and she could not afford to get outside of the public eye. But then things got worse. She started losing weight, experiencing skin rashes, and she felt so exhausted that she could not get out of the bed. Selena thought that maybe she was just burnout, but deep inside, something didn't feel right. And she wasn't wrong. Selena saw many doctors until someone thought that this might be an autoimmune disease. And she got to be evaluated by one of the most famous doctors in the world, Professor Daniel Wallace from UCLA, whom I had the pleasure to meet. As a side note, we were both invited as speakers in a meeting here in California, and I had the chance to tell him how much I appreciate the work that he has done, and I was surprised to hear that he admires my work. Now, going back to Selena Gomez's story, after months of uncertainty, many tests, seeing many doctors, Selena finally got the answer. She had lupus, and the news were devastating. What is lupus? The name lupus comes from the Latin word for wolf. It was first used in the 13th century when a physician from that time noticed that the skin lesions resembled the wolf bites or scratches. Over time, we understood that this disease is much more complex and affects the skin, but also many other organs. We call this a systemic disease as it affects the whole body. Lupus affects people of all ages, but some people are more likely to develop this disease. Studies have shown that 90% of lupus patients are women, most commonly in their childbearing age. Lupus also affects more African Americans, Hispanics, Asian women, much more than Caucasians. Researchers believe that this is due to genetic, environmental, and hormonal factors. 1.5 million people in the United States and at least 5 million people all around the world are estimated to have lupus. But the exact number is not known and could be higher because lupus is very often misdiagnosed or undiagnosed for many years. Lupus is often called the great imitator because its symptoms can mimic many other diseases. But what are the most common symptoms of lupus? Extreme fatigue. And this can be draining because it doesn't improve with rest. And then fever, chills, night sweats, without the signs of having an infection. You just feel like you have an infection, but you do not. And then the classic rash, which is called the butterfly rash because it is disposed across the cheeks and the nose on lupus patients. And then sores or ulcers in the mouth. They are very common, and many times they are not painful, but they can be very bothersome. Another sign are joint pain and swelling, especially in the small joints, from the hands, from the feet, from the wrist, and sometimes the big joints. Patients will also describe a lot of morning stiffness that will last for more than an hour, but that will improve with movement or as the day goes by. And then another symptom is hair loss that can affect the scalp or other parts of the body. The hair loss can be diffuse or can come in patches. So if you wake up one day with a patch of hair loss, see a doctor. Other signs are shortness of breath or chest pain. If you take a deep breath and you need to stop because you have this chest pain, this is not normal. If you have shortness of breath with walking, this is not normal either. And then brain fog, headaches, memory issues, and even psychosis, especially when you are sharp and you had no issues like this before. You need to be evaluated. And then you might also have urine changes, like blood in the urine or a foamy urine, And these are signs that something is wrong, because lupus symptoms vary from person to person. Diagnosing this disease is not always very straightforward, and it will require a combination of blood tests to look for cell counts, autoimmune laboratory tests, liver, kidney function. It will involve urine tests to look for protein levels in the urine or blood in the urine, and could also involve imaging tests like x-rays or an echocardiogram to check if there are any other organs affected. And many times we also need biopsies, especially biopsy of the skin or biopsy of the kidneys to confirm the diagnosis. And that is why between 2013 and 2015, Selena Gomez had to pause her career and she started to disappear from the public eye.
I wasn't understanding my mind, I wasn't understanding my reactions and my emotions. And I think that was probably the most painful time in my life.
But even worse, her career break started sparking rumors. And they were talking about that she is struggling with addiction. But in reality, she was fighting for her health behind closed doors. Selena had to reveal in an interview that she had to go through chemotherapy, and this is a treatment normally used in people with cancer, but it's also used in patients with lupus to manage her disease. But that was not all. The worst was about to come.
After undergoing so many tests to monitor my kidneys, my doctors told me I had lupus nephritis, one of the most common complications of lupus. They said that I would be needing a kidney transplant. So it actually got to a point where it was life or death.
Lupus doesn't just cause fatigue and joint pain. It can attack other vital organs. And for Selena, the disease went after her kidneys, leading to lupus nephritis. Lupus nephritis occurs when lupus causes inflammation in the kidneys, which destroys the kidney function, making them unable to filter the waste from your body properly. 1 in 3 people have lupus nephritis at the beginning of their diagnosis, while up to 50% of lupus patients will develop it over time without the proper treatment, and that leads to kidney failure. The most common symptoms of lupus nephritis include swelling of the legs, swelling of the feet, high blood pressure, a foamy appearance or a bubbly appearance of your urine, which is a sign that there is protein leakage in the urine, or the presence of blood in the urine. And just to let you know, no protein or blood should be present in the urine in normal people. If the kidneys are severely affected and they cannot filter the waste from your body, then patients need dialysis. And some patients need to get a kidney transplant. And this was the case of Selena. Her kidneys failed and she needed a kidney transplant immediately. Because I worked for 5 years studying immunology and genetics of people who received the transplant, I can tell you I understand the process very well. And I know how hard it is to find a kidney donor. But Selena was very lucky.
Luck would have it, Selena's donor was another celebrity, the actress Francia Reza. She gave me the ultimate gift and sacrifice by donating her kidney to me.
In 2017, her best friend, Francia Reza, stepped in. Without hesitation, her friend offered to donate 1 kidney to save Selena's life. The surgery was a success, but her struggles were not over because she was not cured from lupus. She continued to need treatment for lupus, and she needed treatment to keep her new kidney functioning. Now, how successful are kidney transplants for lupus patients? Kidney transplants are generally very successful in lupus patients, with a 5-year survival rate over 90%. However, 10 to 30% of patients may experience a recurrence of lupus in the transplanted kidney, which is why it's essential to continue treatment for lupus. For years after her transplant, Selena continued to deal with lupus flare-ups with anxiety and depression, because it is hard to manage a demanding career and also manage a chronic condition like lupus. And I know that from my patients. But in May 2024, Selena shared some amazing news. Her lupus is now under remission. And that means that while the disease is still in her body, it is no longer actively causing damage. Selena has since used her platform to advocate for lupus awareness, for mental health, for the importance of taking care of your body. And her journey is a powerful reminder that even if you look fine on the outside, your body could be fighting a battle that no one else can see.
The time is now. The turning point we've been waiting for is here. For this very complicated disease, the answer is just not within reach. The answer lies within each one of us. Now more than ever, we're all in this together. We are so grateful to all of you.
And now that you know about Selena's lupus battle and how she managed to survive it, you might be curious about another celebrity in which another autoimmune disease was threatening to destroy her career. So you can watch it here.